Glucose meter is a medical equipment. Look at this picture, shows that definition. A glucose meter, also known as a glucometer, is a medical device used to measure the concentration of glucose in the blood. It is primarily used by individuals with diabetes to monitor their blood sugar levels and manage their conditions effectively. Types: 1. Standard glucose meter. These require a blood sample, usually obtained through a finger prick. They provide a numerical reading of blood glucose levels. 2. Continuous glucose monitor (CGMs). These devices are worn on the body and measure glucose levels continuously throughout the day and night, providing real-time data and trends. 3. Smart meters. These can connect to smartphones or other devices to track glucose readings, provide features like data analysis, reminders, and sharing capabilities. 4. Non-invasive glucose meter. Although still largely in development, these devices aim to measure glucose without drawing blood. Parts: 1. Display screen shows the glucose reading and other information. 2. Test strip, a disposable strip that contains reagents to react with glucose in the blood sample. 3. Lancing device, a small device used to prick the skin and obtain a blood sample. 4. Battery powers the device. 5. Memory function. Some meters store past readings for tracking trends. Uses: First use, blood sugar monitoring, essential for individuals with diabetes to check their blood glucose level regularly. 2. Medication management, helps patients adjust their insulin or other medications based on glucose reading. 3. Dietary planning, assist in managing food intake and understanding how different foods affect blood glucose levels. 4. Exercise management, provides insight into how physical activity impacts glucose levels. Precautions: 1. Hygiene, always wash hands before testing to avoid contamination and ensure accurate reading. 2. Use of new test strip, ensure that test strips are not expired and are stored properly to maintain their effectiveness. 2. Proper lancing technique, use clean, sterile lancet for each test following guidelines to minimize pain and discomfort. 4. Collaboration. Some meters require regular calibration for accuracy, so refer to the manufacturer instructions. 5. Record keeping. Keep a log of reading to discuss with healthcare providers for better diabetics management. How to use. 1. Preparation. Gather all necessary supplies, glucose meter, test strips, lancing device, alcohol swab, and a tissue or cotton ball. Wash hands thoroughly with soap and water, or use an alcohol swab to clean the fingertip. To insert the test strip, turn on the glucose meter and insert a new test strip according to the device instructions. 3. Prepare the lancing device. Set the depth of the lancet, usually adjustable. Load a new lancet into the device. 4. Obtain a blood sample. Use the lancing device to prick the side of the fingertip. Wipe away the first drop of blood with the tissue or cotton ball, and it may contain intestinal fluid. 5. Apply blood to test strip. Gently squeeze the fingertip to obtain a second drop of blood and apply into the test strip. Some meters may require you to touch the strip with the blood drop, while others may have absorbent areas. 6. Read the result. Wait for the meter to process the sample, usually a few seconds. Read the result on the display screen. 7. After testing, dispose of the used test strip and lancet safely. Record the reading if necessary and follow up with any required actions such as adjusting medication or food intake. 8. Clean up. Wash hands again after testing and dispose of materials properly.
Thank you. Have a nice